Hello, I'm Cristina Garcia-Vivar from the University of Navarra in Spain. I work in that university as an associate professor. I'm very happy to share with you my research interest in family nursing. I have two main focus on research. One is related to families living with chronic illness, especially cancer or dementia, so the experiences of families living with the chronic conditions. And the second is related to the family system nursing implementation. And that's the topic that I want to discuss today with you. In my university, we are at the moment conducting a research with Dr. Ana Kanga and other colleagues, which is related to the effectiveness of the training education for Spanish nurses based on the family system nursing. And we are really happy because this was a study that was granted by the government, by the Ministry of Education for the period 2013-2015. So we are almost finishing the research. And hopefully we will have results and articles to be published soon. Well, as we all know, when there is a chronic illness within the family, with the person, the whole family is affected. This is a family affair. Usually, or very often, when there is a chronic illness in the family, there are changes within the family functioning, family dynamics, family roles. And in response to this, nurses need to meet these needs, and for this they need to be prepared in family nursing practices. So that's why we know that there are many research conducted on this topic. However, as far as we know, we didn't found any research conducted with Spanish nurses related to this theme, to evaluate the education training, to see whether nurses were competent to practice family nursing. And that's why of our study. And I would like to tell you a bit about this research. In order to answer to this question, we developed a randomized controlled trial. And participants included nurses from the north region of Spain, and they were from different backgrounds, from mental health, from family and community nursing, and also from gerontology nurses, because we thought these were the nurses who were more in contact with families, especially within the community and at home. So we recruited 72 nurses from the whole region of Navarra, the north of Spain, and they participated in the research. And the research was focusing on giving training to these nurses. So we developed two courses, one which was directed to a control group, and this course was related to general ideas about the impact of chronic illness on the family, and general ideas about family instruments to assess family needs. In contrast to the intervention group, we developed a 24 hours training, which was more advanced in family nursing practice, including the impact of chronic illness on the family, family instruments such as the genogram, the ECOMAP, family interview, therapeutic conversation, so everything related to the Calgary family model. And we gave this training to the control group and to the intervention group. And the primary outcome that we measured was whether nurses who were in both groups, but especially in the intervention group, achieved the competence for family nursing practice. And so we evaluate skills, attitudes, and knowledge in the whole groups, in the intervention and in the control groups. So, as I said before, I don't have the result for the moment. We have preliminary data, but the findings for the moment are very positive, and they found that this educational intervention is effective for nurses, so to practice family nursing and to care for families with chronic illness. So hopefully next step will be to implement within different hospitals in the north of Navarra a family nursing approach, and to evaluate what is the impact of family nursing practice on families, on nurses and on the organization in terms of stay at hospitals, in terms of job satisfaction for nurses, and for example for families in terms of satisfaction, if nurses cover their needs when they are at hospitals and in other settings. So in summary, we would like to do the transition from knowledge to practice, so making the knowledge transition study. So we are very, very happy that this will be possible, and hopefully in the next video I will share with you the results. Thank you very much.